And thanks very much for today and your lovely, wonderful talk today about the importance of mental health and physical health for the mental health division. Maybe you could expand a little bit more on that for us.
Yeah, I think this is something that we're very committed to in the mental health division. So the whole idea of improving physical health for mental health service users is becoming a really critical area of development for us. We've talked about it for a long time, and I think this concept of healthy minds, healthy body is something that we absolutely have to address, because first and foremost in the mental health services we are healthcare providers, and I think that we have to build into our work this idea of a whole of health and a whole of body approach to how we deliver services. We know already that the health outcomes for people with severe mental illness are very poor in Ireland, about 20 years less than the general population. And I think it's really time for us now to embrace this, I suppose, the broader knowledge. We have a lot of people here today who are very committed to improving health outcomes and working together to actually look at how we can deliver services in a more coordinated way.
And one of the things I found from Professor Nash's talk this morning was the whole area of barriers to access and beliefs about change for individuals with mental health difficulties. What was your own take on those areas when it comes to improving service provision for mental health service users?
Yeah, within the division we are already fully committed to the concept of recovery, and I think all of our services have to be recovery oriented, and I think within that comes the whole ethos of supporting people in their recovery, supporting people to change and to make the changes that they want to make in their own lives, and also as the service providers to ensure that we provide the right type of access for people. So, we have to work with people who use our services to hear about their experiences, and where barriers are identified or areas of improvement are identified, work to actually address those and ensure that we have greater equity of service provision.
And I can't let you go, as the National Director for Mental Health Services, to really talk a little bit about your focus and your passion on recovery, because this is something you brought up this morning. I think it's really important that you share that message with everybody, because I think it's critical.
Yeah, absolutely. We've had Advancing Recovery in Ireland working now for a number of years. We had 8 pilot sites, we're up to 13 sites now. And whilst this started initially as a pilot site initiative, it is now an ethos that we are rolling out through all services. So I am very clear as the National Director that our services are, travelling in the direction of recovery, and that is ultimately what we are aiming for. In mental health it's critical that we work with people who use our services to support them in their recovery. And I think this is something that we know, we've heard it from many people. We have the experience of RE nationally now, and I think that recovery has to be fundamental. I obviously come from a clinical background as an OT, so it's in there somewhere as well, I guess. But as a management team and as a division, I think we are fully committed to this, and this is something that we want to see across all services. And in 2017 we will be looking at, the real steps that people are taking to implement a true recovery focus.
Thank you very much, Anne.
Thanks, Eddie.